This is She's on Call, a weekly show hosted by ENT specialist Dr. Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's on Call, hashtag She's on Call. Please welcome our hosts.
Hello, I'm Dr. Sujana Chandrasekhar. I'm an ear, nose, and throat surgeon in Manhattan and New Jersey.
I'm Marina Kurian. I'm a general surgeon, does minimally invasive surgery and weight loss surgery and actually some medical weight loss, and I'm in New York City.
Welcome to She's on Call. We're very happy that you've joined us today, and we have a very special show on tap for you.
We have two wonderful guests. We're going to talk about some of the issues mental health issues that came up during the pandemic. And also we're going to look a little bit boots on the ground of how our learning and teaching is different now. And our guests are Dr. Judith Chusid, who's a clinical psychologist in private practice here in New York City. She's also got a book that you're going to hear about, Success is an Inside Job. And then we also have Carmen Simmons joining us, who's a fourth-year medical student at Mahari, and we're going to be talking to both of them a little later.
We are live on YouTube, Twitter, Facebook, all social media platforms, and on scroll.in. So please like and tag your friends and share and ask them to join in on the conversation. Before we meet Dr. Chusid and Carmen Simmons, we're going to talk a little bit about the medical news of the week. So unfortunately, America still leads the pack. The United States just topped 5 million COVID positive test results or tests, people who are positive for COVID. And our death rate is very high. We all know that there are issues here with testing. So the denominator of who is tested and how many tests we're doing is not well known. Meanwhile, New Zealand, which has about 5 million people in it, had its first case on February 26th and its last case of community transmission 65 days later, which is 100 days ago. So they have eliminated it from their country.
Well, and it's complicated, right? When we talk about something like this, and I think, while I believe I did the quarantine. I was in for 9, weeks at home, not operating, and practiced all the social distancing and masking, et cetera. What New Zealand did is they closed their borders. And the question is, what happens when the world starts to open up again? I mean, is the plan now to wait for a vaccine, vaccinate everyone before you let people in? So it's very complicated. And I think that at least in New York and in the US, one thing that is different is maybe we're leading the pack because we're actually doing a lot of testing. And I don't know that all other countries are doing as much as we can. I believe we had a slide up on Brazil and their testing. And it's hard to say if it's similar to what we're experiencing here. And there's also that disparity, right? That certain communities are not getting as much access to testing as others. But I think you said it best that the denominator is really the issue. And we think when we look at some of the stuff from New York State, that we're at a 1% positivity rate amongst tested people, which is, I think, where everyone, all the epidemiologists and immunologists and infectious disease docs, where they are figuring that this virus will really land.
Yeah, I think we're trying to find the right target scientifically so that we can actually open up our cities and our country and our world so that we can get back to whatever the new normal will end up being. On the slide from the New York Times that we had up just a second ago, you can see the hot spots around the world and in the United States. And in the US, the cases are rising the fastest in Oklahoma, Hawaii, Puerto Rico, South Dakota, Virginia, Rhode Island, Illinois, and Massachusetts. And that's after cases were going down in Massachusetts and some opening happened. So I think, Marina, you're really right about what do we do as we start opening again? How do we maintain a healthy environment for people to live and work? And I think let's talk a little bit about the new data regarding asymptomatic carriers versus pre-symptomatic carriers. Maybe you can talk to us about that a bit.
I don't really want to, because I think it's confusing, but here it is. So there's a study that came out of JAMA that said that asymptomatic carriers seem to have as much virus as people who are symptomatic, raising the question about how long should asymptomatic people be quarantined. So that is so confusing, because right now we're like, okay, if you're asymptomatic, we give it like, a few days, like a week, 10 days, see how you feel. But should you be in for longer? Are we going to then look at titers and how much viral titers that they have, and when can you go out? And so we don't have the answers. And I think this has really highlighted some of the issues that we have globally, in that doctors and, the immunologists and the epidemiologists, we don't actually have all the answers, because this virus is not following a normal path. And because we can't rely on historical examples, we're really all just finding our way. And I think that, I am a mask believer. I believe in wearing a mask. I believe in, washing your hands and social distancing as much as you can when you're in public. Of course, if you're completely alone and no one's around you, you shouldn't wear a mask. But I do think that wearing masks help. We have some data that suggests that it does. Suju, if you want to go into that data.
Sure. So there's the Institute for Health Metrics and Evaluation, unfortunately says that United States, which has had about 160,000 deaths so far, is on target for 300,000 deaths by December 1st. And they attribute a great deal of this to the fact that only 50% of our population is wearing masks when they are out and about in public, in stores, in crowded areas, at their workplace, let's say. If that number went to 95%, so if all of us essentially just took the small step of wearing a mask when we leave our house, that we could reduce that added 140,000 deaths by 70,000. And that's a huge number. And that means we'd also reduce the numbers of cases that we're treating in the hospitals. So a couple of graphics have come up. We're all used to no shirt, no shoes, no service when we go into establishments. And it's not that hard to also put on a mask when you're going into a store. So I think that's very reasonable. We touched on schools opening a few times in our show.
Yes. My kids are going to go. This is Union College, everybody. Okay.
Oh,
repping Union. But my kids are going to college. I'm driving them. We're flying, actually. We're going to fly them out there. But I think talking about schools opening in New York State, that's going to actually happen both in New York State and New York City, because our positivity rate is so low. But we wanted to talk a little bit about what's happened in other states, and specifically Georgia.
So there was a couple of pictures that went viral showing very crowded hallways in a high school in Georgia. We're showing this from the back. These are children, after all. Most of these were not wearing masks because it was a mask optional mandate. They did other things. They did distancing and cleaning, but they made masks optional. What the graph on the slide shows is the positivity rate in Georgia. So Marina said New York State has a positivity rate of 1%, and all the experts say it should be below 5% to open schools. And you can see that in Georgia, it was as high as almost 15% and maybe even 17% earlier, and now it's at 11%. And that seems to be a contraindication to opening schools, particularly if there's no mask mandate. If you look at the numbers in New York, which is the next slide that we have, this shows that we had a huge high positivity rate at the beginning of this pandemic, and we've really gone down to the less than 1%, which is a very safe target for when we open schools. And we hope that as we open schools here and as people are riding the subways and going to work, that we keep that under 1% rate.
Yep. So that's our synopsis for the week, I think, and we're.
Oh, just to remind our viewers, we answered a number of your questions regarding schools opening, and we're going to put that out on Tuesday morning. So take a look at the number of questions you guys sent in, and we're going to answer them online on Tuesday morning.
We're super excited to have our guests come on. And so we have Dr. Judith Chusid. She is a clinical psychologist. She put out her first book, which is on fear of success. I know you guys all think, no, what are you talking about? It's fear of failure. No, fear of success. It's a real thing. And then also Carmen Simmons is joining us, and we're going to pepper her with questions about how her education has changed in this past year or half year, and what's going to happen in the future. She's also very active on Twitter, so we're excited to have both of them join us. And you guys who are watching, if this is not your first rodeo, you guys can send us questions. We're happy to answer them with our colleagues.
And please like and share and let your friends know, because these are two wonderful women who have a lot to share with us. So welcome aboard, Judith and Carmen.
Pleased to be here.
Yeah, thanks so much for joining us. Judith, I wanted to touch base and start with you. When we first invited you, I was like, can you talk a little bit about, emotional health during the pandemic? I know I carry on all the time. Judith's been on my radio show before, and I always make every session about me. I promise not to do that today. So you guys have to write and ask questions, because otherwise I'll be like, well, listen, this happened to me. What do I do? Okay. So, but, there's so much uncertainty. There was so much fear of keeping your job, losing your job, of how are things going to proceed, of being afraid to leave the house. So many different factors that impacted our mental health. And so I know you had some great ideas and suggestions and thoughts on the topic, so we'd love to hear about it.
Thanks for having me. I'm happy to be here. What we're seeing in the psychological area is families being together more than they ever have been. Children home from school, parents home from work, parents trying to work in the house while the children were on Zoom or trying to do their work. So there was a lot of stress, and people not having been together for so many hours at a time. And we found that the children were in a state of fear that they could not express. They felt a lot of uncertainty. They didn't know what was going to happen. They were on a strange mode for, they're used to being online and screens, but they're not used to going to school and then having part of their school day on Zoom, part of their school day doing independent work. So we found that the best way to handle things would be for the parents to lead the way and do the 3 S's: schedule, support, and self-care. And in the scheduling arena, we ask parents to create family and individual schedules so everyone knows what they're supposed to be doing and have some kind of structure to the day, because all the structures have been taken away. We want to advise people to put into their daily routine exercise and fun relief stressors that the family does together or the kids do together, or if you have an only child, that the only child does, maybe with their friends online. And we're advising people to get support, that the parents for themselves and help their kids to create an inner circle of support composed of trustworthy, upbeat family members, friends, and colleagues. And that's very important because there's so many stresses going on that you really need support, and you need people to hear what you're feeling and people to give you some advice. So that's very important.
I love what you said about the kids being, not that I love it, I think it's terrible, but the kids being afraid to voice their fears. And I know that in some of the things we talked about, you do feel that parents have to sort of discuss with their kids some of the issues, but also model behaviors so that the kids get their stability from them.
Yes. I didn't put it in my presentation, but maybe there's a way we have a feeling chart. It's called the 8 Basic Emotions. And we've given it to all the parents, and we've given it to a couple of schools that we've consulted to. And we asked the parents to keep the chart in different places in the house. So the chart has large feelings on it. That's why they call it the Big 8. Anger, fear, pain, joy, love, passion, shame, and guilt. And then next to those feelings are little words, like for anger, are you irritated? Are you annoyed? Are you frustrated? So that the children have check-ins every day where they can kind of begin to learn how to articulate their feelings. One of the problems was kids could not say, and the teens could not say what they were feeling about this pandemic. Everything has changed. A lot of the parents feel very worried about their economic situation. Some of the parents own businesses that could not be running. So they're very, very worried about what's going to happen in the future. And many people in New York left New York, actually. They either went to country houses, or some of our clients went to the mountains in North Carolina as far as they could get from populated places. And, the kids didn't have their friends around them. Not that they could have socialized, because many of the parents would not let their kids socialize in person, but they were just in strange places with no support. So we wanted the parents to help the kids articulate their feelings, and then we had to tutor the parents on what do you do now with all of this? How do all of you function together in this very, very uncertain, abnormal moment in time?
Yeah, it's been a really rough road. I think, 5 months has been no joke. And I think certainly healthcare workers started with sort of a panic, anxiety that we were going to be the vector of disease to our families, and had to use many of these tools to not irritate everybody or upset everybody in the house. I wonder, Carmen, Leela Rangachar just checked in from White Plains. We have Mark Lee, who just checked in from North Carolina. Sandra Lefkowitz, who checked in from Glenridge, New Jersey. Thank you guys all for watching. Leela is starting her first year of medical school at CUNY Medical School. And I think you have been in this period of great transition, where not only are we learning about a new disease, but we are learning about different ways to teach during this disease, different ways to allow you guys to become the best doctors, so that when we get old, we have amazing doctors to take care of us. So Carmen, I wonder if you can talk a bit about your experiences at Meharry Medical College, and what do you think has changed for the good and for the bad?
Okay. So I'm currently a 4th year. Actually, I am officially a 4th year as of because all of these changes happened with our curriculum. So we delayed, and we had to figure it out. So I should have been a 4th year a month ago, but Friday technically was my official last day of my 3rd year rotation. So I'm very excited about that. But actually, Meharry, so we're in Nashville, Tennessee, and we're actually the testing sites for our national population. So we've been the ones that have been administering the test. And at first, in March, the students were able to help. So me and my friends, we were out testing, and we were all geared up from head to toe about. And I think at first people were really scared to just leave the house. So there wasn't a lot of testing at first, but then about a month in, it surged. So I think we're serving over 1,000 people a week or something. We have a lot of testing sites now. We have like at least 4 or 5. I should know that, but we have one on the main campus. We have one at our stadium and one at a Kmart, and then some other sites too as well. And we've been partnering with some local churches as well. But that first month, I would say March, we didn't know if we were going to shut down school. We didn't know what was going to happen to our rotations. I'm a third year, so it's been really tricky for us because we're in the hospital, and we have to see patients. So for a while, they took us out of the clinic, and then we started doing electives, online electives that we would be doing for our 4th year anyway. So I thought that was a really cool transition that they did. So they allowed us to keep on track. So, we were all very worried about how are we going to graduate? Is match day going to be the same day? How is, the application cycle going to work this year? What about CS? So I think the good things that happened definitely were we're still on track to graduate on time. And I think for me, that's probably super biased. But I'm really happy that I don't have to think about, will I graduate in May? And then also having that time away where we were able to do our online electives was really beneficial. I actually went home, so I think it was very interesting that you were talking about the children that were going home. So I'm currently 27, and I went home for, I would say, about a month, and with my mom. And I was really scared too, because I had been doing the testing and all this stuff, and I had no idea if I was exposed. So I did a mini quarantine, and then I went to Georgia to my family. But I will say the bad has been, you don't know which patients are COVID positive because we have such a high amount of people who are asymptomatic and don't have any symptoms. So even when we do our screenings and we try to make sure that, so as students, we're not allowed to go see COVID positive patients or patients who are like symptomatic with the kind of stereotypic signs of shortness of breath and fever and things like that. So we're not allowed to go see those patients. However, you kind of have to treat everybody as if they're COVID positive. And at first, when we first went back, it created this dynamic where you don't feel close to your patients. It's different. You have all these things that are kind of not in the way, but you have a lot of anxiety. I think as time went on, we got a little bit more comfortable. At least I did. But you really do. You have to treat everybody as if they're positive, and it's kind of scary. So, but I think, I'm not exactly sure where our future is from now. I'm a little pessimistic about it, to be completely honest, but I've been finding the bright side, and I bought a whole bunch of different masks in different colors, and that's been my way of keeping positive in the pandemic.
So how about Carmen, your rotations? Like, you're not going into positive patients' rooms, but this is, you weren't there, but it's very reminiscent for Suj and I. We were medical students during the HIV crisis, and we did have, that's where universal precautions came from, but universal precautions are actually not enough. We have to add the mask and the gowning, which is more than we do actually with universal precautions when we're dealing with bloodborne. Because this is respiratory borne, there's like a different level. But, I was amazed during quarantine thinking, wow, like this is really going to shape an entire, group of cohort of doctors into a new, way of dealing with this. The other thing that I think that came up during this time is telehealth. I already had a platform up and ready to go, but I know that many of my colleagues didn't, and we saw across the country everyone scrambling to get telehealth up and to get reimbursed for it from insurances. And then everybody moved to do that as quickly as possible. And while telehealth was one thing, I'm sure Carmen and both Suju and I are like, we are zoomed out, man.
If I'd never do another Zoom again, which is not happening anytime soon, I will be happy.
Yeah. Zoom.
I have to say, your fan club loves you. Sydney Peak and Nicole Krappel, very excited to see you here. Sydney wants to go to Meharry in a few years. I know you're planning to go into family practice.
Yes.
Can you explain to our viewers what is the specialty of family practice, and then let us know how your interviews have been?
Okay.
Because those are online too, right?
Yeah, everything is online, which, it has its pros, but it definitely has its cons too. The pros is I don't have to leave my house and I can do my makeup up until the last minute. So that's cool. But the cons are that I'm in the house all the time. So that's a con. But yeah, speaking of telehealth, one of my electives actually was medication as treatment for our Suboxone clinic here at Meharry. And I did my research project actually about implementing telehealth. And our population is extremely disenfranchised. Over half of our population experiences homelessness. So there was a lot of questions too about how we were going to implement telehealth, how we were going to get to our patients, and especially with Suboxone, you have a lot of restrictions and a lot of requirements to dispense those. So it's been interesting. And so the telehealth has been really good though. So we have had a lot of success with it. So I'm very happy about that. And for our interviews, actually was just at the Family Medicine National Conference. And yeah, we're all figuring it out. We're all on Zoom. I think actually people are becoming a lot more Zoom friendly and Zoom literate, I guess you would say. And so I think people are now doing it a lot more with ease, and people are getting more comfortable with it. But I mean, it is interesting for me personally, and I know for a lot of my friends, is that a lot of the things we would do normally on a rotation or during the application cycle is to like fill out the residence, fill out the program, the location, things like that when you're traveling and interviewing or even doing away rotations, which we're not able to do this year. So navigating where you want to go to residency is a huge question. And now it's been complicated because we don't have those experience. And it's kind of hard to kind of get a feel for a program through Zoom or through just, talking to them over the computer. It really is. But I mean, people are everybody's in this together. I mean, it's the same thing for the residents and this residency. Like they have to figure out who we are. And they don't get a real chance to see us interacting with anybody or in person. So, yeah.
Well, Judith, she brought up a great point that everyone's trying to sort of see and get a feel for a program. And one of the things that has always been discussed, so when I do the bariatric weight loss, I will use some telemedicine psychologists, let's say. And that's been controversial in the society because they're like, no, you have to see them in person, because you get so many physical cues. But pandemic, quarantine, and now everyone's on telehealth. What are your thoughts on telehealth for psychoanalysis and helping? Because I feel like just showing up and seeing like a face is still like half the battle. I was so excited to see my patients. They were excited to see me. My kids slept till 2:00. So, I was isolated until then. They'd wake up. So it was great people. I could talk to them online. What are your thoughts about it?
Well, there's a couple of things that happened. First of all, I was seeing clients on the West Coast in late February, and I came to see my daughter in March. And two things happened. She had a bad fall and she broke her collarbone and needed surgery just as the lockdown was happening. And I got stuck in the lockdown and I got a compression fracture. So I actually had firsthand experience with how the medical profession was going to handle both issues. She was the only surgery the day that she had her surgery for her collarbone because they didn't do any elective surgeries. They only did, completely necessary surgeries. And I was on telehealth with my compression fracture. I went for x-rays, and then by the telehealth, they sent me for MRI to see what happened with the compression fracture. So I have a sort of experience with this, and it wasn't until recently, that I was in the office with the doctors working with my issues, and Victoria had to go in, for post-op. They saw her for post-op, there was one patient at a time. She had a mask on, she had gloves on, and then they scooted her in and scooted her out. As far as psychology goes, everyone is on Zoom, and we've had a big challenge. We have kids as young as 4. So how are we going to do the therapy session where half the session the kids talk and half the session the kids play? and we needed to do a lot of creative work for this. So I brought into my practice people who were teaching, had been on Broadway and were teaching kids drama on Zoom and doing, activities, drama activities, and all kinds of skits on Zoom. And we brought in people who were in the occupational therapy and art therapy to do art therapy for half of the session, on Zoom. Our patients right now do not want to come to the office. I'm still in LA. It's the longest period of time I've ever been away from New York. And my daughter and I have been quarantined together with another friend of hers. And we pretty much, except for going for groceries here and there, have just been with each other. And so I'm experiencing what my patients are experiencing. And the patients that are on Zoom, we're finding two things. It's not the same as being in person, but it's really a good second best. Zoom and FaceTime and Skype have worked for us, and we've started new cases, and we're doing consulting to the schools, because the schools in New York, some of the private schools are going to be hybrid. Some kids are going to be in the classroom, and some kids are going to be on Zoom, because a lot of the parents will not send their kids back to school in New York. So we're doing well with Zoom. I think some of the psychology people are getting zoomed out. In my practice, we spread out the sessions so that we don't have 8 hours or 6 hours straight on Zoom, because it gets to be a bit much. People get zoomed out.
So I think that talks to your 3 points of scheduling, supporting, and doing self-care. I want to remind everyone we are live on basically all the social media channels. Please like and share and tag your friends. Leela Rangachar is starting medical school and wants to know, Carmen, if you've got some tips for new medical students, how to succeed. And maybe I'll add to that and say, what was your, once you answer that age-old question, let us know what your journey was and how you came to an HBUC and how you chose family practice.
Okay. So first of all, Leela, please go to sleep. Please go to sleep. That is probably my biggest advice, is go to sleep. For me, my journey through medicine wasn't super direct, but it wasn't, I think it's pretty stereotypical of a lot of other people's shared stories. I was one of those, weird kids that said that I wanted to be a doctor, and that's kind of what I kept to. Actually, my grandmother, who she's watching now, actually, she took me to a dermatologist one time, and she used to wear these like big earrings, and her earlobes got elongated. And so the dermatologist, who's actually a Black woman, she let me put the lidocaine in and help cut the earlobe. And I was like, wow, this is it. This is what I'm supposed to do. And that was in middle school. So that's really where I solidified where I was going to medicine. I was like, wow, you get to do this for your job? That's crazy. And I went to college. During high school, I took AP classes, and I did joint enrollment, which I highly recommend to anybody who's still in high school to do joint enrollment. I came into college with a lot of credits, and it gave me a lot of freedom. But what happened is I placed out of chemistry and biology, the first one, or like bio 1 and chem 1. And I went straight into bio 2 and chem 2. And honestly, I just freaked out. I felt super overwhelmed, and I didn't think that I was smart enough or I could do it and everything. So I dropped the classes, and then I was like, well, that's it. I guess I can't be a doctor. I didn't take chemistry my first year, so the doctor thing is completely out of the question. And I explored a whole bunch of different majors, which I am actually so grateful for this experience, because I got to study abroad in Brazil, and I studied public health, human rights, and race in Brazil. That was super awesome, as well as I was able to explore some other things that I hadn't thought about, like marketing. And I did an internship in London. So one of these, it was a very big blessing in disguise, because it allowed me to think about other things I wanted to do. Like I said, I was so little when I said I wanted to be a doctor. I'd never thought about anything else. So I'm really glad for that time. when my senior year in college, I had a meeting with myself, and even though I really like these other things, still deep in my heart, I knew that I wanted to go to medical school and I wanted to be a doctor. So I did a post-bac, and during my post-bac, I actually became a doula as well. So a doula is someone who helps women during childbirth. And I applied. I got into Meharry, so I'm really thankful about that. Meharry's been a huge, Meharry is so culturally impactful for my community as an African-American woman and as somebody who's been interested in medicine for a really long time. So I was super happy to go to Meharry. They have such a great legacy. Almost all of the African-American doctors that I know, especially older ones, went to Meharry. So that's why I'm here.
So really, you want to be an ENT because you wanted to repair ear lobules. That's all I heard. And then I heard a lot of blah, blah, blah.
Lobules? Look at you. I thought they were just lobes. Now they're lobules.
Lobules.
We do want to talk. Guess what I have?
Mm-hmm.
I see this.
Oh my goodness.
As soon as I heard Judith's book was out, I've known Judith for a long time, and she's been working on this book for a long time. And I've not finished it yet, but I'm into it, a few chapters in. And, it is such an interesting concept of not having a fear of failure, which is what we're all familiar with, right? But a fear of success and where all that comes from. So I want to have her Judith, please just discuss a little bit of how, this whole concept came up in terms of, your work with athletes and your work with corporate America. And you're also doing a lot of individual and family work as well.
Right. Thanks. Yeah, I'm so happy. You and I have been talking about this book since 2011. It took 10 years to finish the book. And it's pretty much everything, all my research and everything I know about how to overcome any kind of block that would prevent you from doing the career or creative endeavor that you are meant to do. Just like Carmen was saying, she knew in middle school what she wanted to do. A lot of people are afraid to go to the top of their game. But I'm finding in COVID.
So I think Judith froze. Oh.
No.
Go ahead. Start again, Judith.
I'm finding in COVID that a lot of people are rethinking their life. Am I in the right job? Am I living in the right place for me? And what do I want to do next? And so I think the book is coming out at a very interesting time because the book covers any kind of career issue that you would have. If you're not clear about your vision, if you want to make a career transition, if you've been underachieving, if you're at the top of your game and you find that you're doing something that's self-sabotaging, so we hear about this in the news all the time, a Tiger Woods or a Lindsay Lohan, or someone who's at the top and then sort of does something self-destructive. So I think that the book is timely, and most people don't know that they have fear of success. When you ask them, they'd say, I'd be very happy to be successful. That's not my problem. My problem is this, my problem is that. But actually, fear of success is most people's problem. And an interesting statistic is that of all the children and adolescents that are identified in their young years as gifted and talented, less than 8% use their talents and gifts as an adult.
Wow.
So that means that we have a huge societal problem where people are not self-actualizing. But
so I loved Carmen saying she had a meeting with herself because I think it took me till much older than Carmen to have a meeting with myself and to really know what it is that I wanted. One of my friends said to me, you're having a show about fear of success. I bet you don't have that. And I said to her, you have no idea how many fears I have that I tamp down and I proceed. But maybe, Judith, there's a thing called imposter syndrome, where once you've succeeded, you look in the mirror, people look at you and you look like you belong, but you look in the mirror and you don't see that person. You see someone who got in because she's Indian or because she's a token or because somebody liked her, but not because she belonged there. I wonder if you can talk to our viewers about imposter syndrome and how it contributes to that fear of leaving the pack and rising above.
Yeah. Well, the imposter syndrome really is a self-esteem issue. It's composed of self-doubt, lack of confidence, and unresolved esteem issues. And so that when one gets to the top of their game or they start achieving, they're wondering, why me? And how did I get here? And do I really deserve this? But it's really an unresolved self-esteem issue. And so it's not that they really don't feel that they belong there. It's that they're full of self-doubt. And I have to tell you, I've dealt with the cream of the cream. I've been a sports psychologist to professional athletes. I've worked with CEOs in business. I've worked with over 60 of the who's who in Hollywood. And it's just pandemic that people feel self-doubt, even if they're highly talented and have a legacy and a history of succeeding. There's so many people that have self-doubt, and a lot of people, and it kills some people. It killed Philip Seymour Hoffman. It killed Heath Ledger. You know, it just goes on, because this is not seen, and the people around these successful people don't believe them, don't believe that they have this much internal self-doubt. So I think it's something that people can work on, and we've had a lot of success with helping people in a relatively short period of time, within a year, begin to turn this around. This is a very long-term problem that someone brings with them from the time they're a kid. And we're finding now, I knew that I wanted to be a psychologist at 5.5. And in the book, I tell the story of how I got a group of kids in my neighborhood together to talk about their feelings. And we're finding that if we give kids a chance to talk about what they want to do, that quite early in their life, they know how they want to use their talent or their gift or what they're interested in, you know, where their focus is.
So I think I appreciate that. I think we have a great question from Tacey Silverberg Orion, and she says, how much do you think internalized or institutionalized racism plays in imposter syndrome? So I'm going to actually address this to Carmen, because I think, Carmen, you've had some good self-talks, which other people have commented on that they appreciate, but then you chose a place that was designed to be supportive for people of color. So can you talk to us a little bit about why Meharry, why a historically Black university, and what you think you may encounter in the future as you go on to more successes?
Yeah. So like I previously mentioned, I'm from Atlanta, and Atlanta has a huge professional African-American society. I don't want to say society, but I mean, it's everywhere. So for me, I'm very fortunate that I never had that. I never saw any doctors that looked like me. My pediatrician was a Black woman. Like I said, my grandmother's dermatologist is a Black woman. There's just there's so many Black doctors in Atlanta, or Black professionals in general, that for me, I didn't grow up seeing that it couldn't be achieved. However, when I went to North Carolina for undergrad, I realized quickly that Atlanta's not the same everywhere. Like, that's a very unique thing to Atlanta. And I really didn't realize that. I truly didn't. And I can understand how my friends and other people who were interested in medicine, you know, they may have not seen a Black doctor, or not in person, or like, you know anybody that is a Black doctor. And I mean, that hurt my heart. Like, I mean, I'm so fortunate. But I never felt that way, that I couldn't do this because I've never seen anybody who looks like me who did it. It was just something, it was another job that people had, just another job, and that one that I wanted. So I think it really does play into like that thing, like if you don't see it, you don't know you can do it. And it's not that it's impossible. It's not that it doesn't happen. It just makes it a lot harder to visualize the path and visualize yourself going on that path. So it has a lot to do with it. And I chose Meharry because one, like I said, it has such a historical impact in my community. Almost every Black doctor, especially the older ones, they all went to Meharry. It's, you know, kind of the end all be all school for Black doctors. So that's something that's really personal to me, as well as their mission. I feel like they're very mission oriented, and it's not, they don't just say that they're mission oriented. They do it. We work with the underserved. That is our population. That is the population that we've always worked with, and we always will continue working with. And of course, does that come with, like, you know, some other stuff? Yeah. Like, so sometimes we have to realize, like, resources aren't equitable, and how do we navigate that? So for me, coming to Meharry was one, twofold. Like, I love it here. I feel supported. I have lots of friends and doctors and attendings and residents and staff that look like me, who support me, who can understand my my cultural aspects, as well as they're working with the population. They're working with the African American population, and that's their goal, and as well as others that are underserved. So it's where my heart is, and what I want to continue to do.
Yeah, I think you joining in family practice is definitely that. I think across the country,
Yeah.
You know, family practitioners take care of the majority of Americans, and I think that that's incredibly important. You know, we're talking a little bit about, you said, the disparities of care and access to care.
Yes.
We had a couple of weeks ago talked about that whole hashtag MedKini crisis, right? There was an article that was basically looking at vascular surgeons, recent graduates, and pointing out inappropriate social media posts. And this is something actually from you that you popped up in response to that. And there's so much about this picture I love, but why don't you guys were celebrating something, and also I think you made a great point against the profiling and the bias that's inherent to some of that research. Carmen.
Yes. So this picture we took after we took step one. For those who are not in the medical field, step one is the scariest, most horrible, awful exam ever. So we decided to take a trip after to celebrate that, and we had our red bikinis, and we were on the beach, and we had a good time, and it was nice because once again, Meharry has afforded me to have all of these friends who look like me and who share a lot of similar experiences with me, and we're all celebrating, and we're just, you know, being normal. And I put this picture up, oh my gosh, like almost a year ago. And for the MedKini or the paper to come out, it qualified a lot of my fears that one, you're being stalked, and you're being
it's there forever, Carmen.
You're being stalked, and you're being criticized, and even I remember putting that picture up, and I was like, oh my gosh! When I asked everybody if they were okay with it, and like, you know, we're all going to apply residency soon. Like, I wanted to make sure this is as professional as it could be. Like, so it's funny that I actually made sure that it was as professional as it could be. And then it was still kind of deemed in this unprofessional light. And then once again, like we've been talking, race really plays a huge part of this too. Like, you know, it's no secret that Black women's bodies are hypersexualized and viewed differently than other counterparts. So that's another thing that went into, like, should I post this? Should I not post this? Type of thing. And it's just, I mean, it's exhausting. And you're so scrutinized all the time in medicine for your evaluations, for everything, from yourself even, that it's just kind of, it becomes overwhelming. But yeah, so of course they didn't say anything about the guys, you know, at the beach, you know, in their trunks or whatever else. But of course the bikinis or the bathing suits was the line. And it's just kind of like, wow, just another thing that is striked against me.
So I think, you know, this leads into what you talked about how we are respected as professionals. And, you know, we've talked on this show before about being mistaken for non-physicians when we're physicians, even when we introduce ourselves as physicians. I will tell you, when you get older, maybe not you, maybe you'll still stay fabulous, but when you get older, old lady's med bikini picture looks like this. This is a bunch of otolaryngology women leaders, and we made sure we had our sparkly sandals and our pedicures done. So that was as med bikini as we got. But, you know, there's another picture that made the rounds of Twitter this weekend, and it is the surgical class at Harvard at Massachusetts General Hospital. And, you know, first of all, congratulations to all these people. Getting into a surgery residency, especially such a rigorous one, is an incredible feat. And it really shows their hard work and their perseverance and their dedication. Because yes, although you should sleep in medical school, you should also study, and you should also work hard and be able to present yourself well. But Judith, you may notice, looking at this picture, something striking that maybe was quite different from the med bikini picture we just had up. How can we work in medicine in a deliberative way to make sure our physicians look like the communities that they serve?
Uh-huh. This is a very interesting remark. You know, I've just finished Jodi Picoult's book called Small Great Things. And I don't know how many people have read that novel, but it's about a Black nurse in a totally white hospital. All the doctors are white, all the nurses are white, and she's the only Black nurse. And a white supremacist couple comes in, and they specifically say in the file that this Black nurse cannot touch their infant. And their infant goes into some crisis, and no one's on the floor at that time, and she takes care of the infant, and she's sued. And Jodi Picoult spent a lot of time doing research for this. And there's, in the back of the book, people in the Black community talk about how she approached the book and how she portrayed this very difficult issue. And she talks about how white professionals and the white community are not really aware of white privilege. And I think that everyone has to work together to really come to understand this. The book is very helpful in terms of the story, and things are changing slowly, but not enough. You know, we see this in schools too, where there are Black or children of color, even in private schools, you know, they're in the minority, and they are not being teased because the kids now are being taught at home, and they have different sensibilities, but they do feel different. And I'm wondering if Carmen sees things changing, or does she see things still at a big crossroads?
So for me, like I said, I'm 27, so I'm a millennial, so there's that. But I think it's was it Gen Z now? Yeah. Anyways, so I think for them things are changing, but I don't know if they're changing the right way. So a lot of times, especially those who kind of grew up in the Obama era, a lot of it seemed to be like post-racial. That was a rhetoric that was going around a lot. And like you said, people aren't bullying people because that they're, okay, I would say, well, people aren't using bullying terms to say like, oh, you're Black, or oh, you're, you know, they're not using like racial slurs as much, but it's more microaggressions now. And so you're kind of like, oh, are they doing this because I'm Black, or are they doing this because like I'm weird? I don't know. And you feel that you're othered. So, I mean, while it's great that people aren't calling people racial slurs, and of course that still happens, I mean, it's also kind of this subversive racism that's harder to distinguish. And you're just kind of like, I'm not exactly sure. There's something going on here. I'm pretty sure it's because I'm Black, but they didn't say anything, you know, specifically about me being Black. So maybe it's not that. And especially in like, if you're a woman, you don't know kind of, it's coming from the gender side or the race side, or both, because that it compounds. And so I think what we need for parents especially is that not trying to teach colorblindness and like celebrating differences, and not like, oh, you can't say that because it's a bad thing to say, but like be like, that's a bad thing to say, yes, but we need to celebrate differences. It's okay that this person's different. It's okay that, you know, this is whatever, but not just like, oh, everybody's the same, because it's not true. Everybody's not the same. So what do we need to do to promote finding that balance of celebrating differences, but also not ostracizing people because they're different?
Yeah. That's important. And I consult to a private school in New York called the Studio School. It's on the Upper West Side. And they are teaching their kids very important concepts, not only differences, but you don't have to like someone. You don't have to be their best friend to cooperate and collaborate with them.
Wow.
And it's a very interesting concept, because the students who are there from the younger years through middle school and are going into high school have to give a graduation speech. And they all talk about, in a very sophisticated way, these 14-year-olds, you know, where they were coming from, their prejudices, their problems that they had with themselves and with others, and how they've resolved it at the school. And that's because the head of the school, Janet Rotter, is both an educator and a psychotherapist. And the whole school has the ability to work with resistance and all these different issues that kids have to get over, so that they can have a diverse kind of social life and thought life. So it's very interesting. And Jody Bacolt's, I see in the chat, Jody Bacolt's book is called Small Great Things, and it comes from Martin Luther King's speech, where he said, if you can't do big great things, do small great things. And the book is, the novel is very interesting, because in the back of it, all the major people who are talking about racism and diversity are in the back. They've interviewed her, and she was very concerned about the Black community. Because she felt that she wanted to represent the characters in the right way. So it's a very good book to read.
Yeah, we're gonna post that. But can we have, you know, your last 3 thoughts? We'll start with Carmen. What do you want to share with our viewers before we hold off? And I'm sorry about that, but so last thoughts, both of you guys. But first, Carmen.
Okay. So my 3 thoughts. I had to think about this a lot. And my first thing is just be nice to yourself. We are going through something that, first, we're going through life in general. So just baseline, it's hard, but just be nice to yourself. And we're hypercritical of ourselves, especially for those listening are probably primarily in medicine. We're taught to be hypercritical of ourselves. So just be nice to yourself. What you want to do is possible. So even though it can be scary, even though it can be never done before or whatever it is, what you want to do is possible. You just have to figure it out. It may be hard, it may be long, but it's possible. And find things that bring you peace, especially now, especially when we get past this, but find things that are bringing you peace. I know we talk a lot about self-care, but this is a little bit more than like face mask and baths. It's more about finding things that really bring your heart peace and your soul content. So those are my 3 things.
Beautiful. Out of the mouths of babes, right, guys? I mean, you figured it out, and it took us maybe a little longer. Yeah. Judith, and we have a minute left, so maybe.
Oh, my goodness. So quickly, just keep in mind, parents in the COVID, in these COVID uncertain times, get a family schedule, get support, do a lot of self-care. It's an opportunity right now to slow down, reprioritize. We can help our family live together and work together in more healthy and cooperative ways in this new normal. And we can engage in activities and creative endeavors that we've put aside or didn't make room for before. So keep that in mind. And as Carmen said, take very good care of yourself and find things that make you happy and find things that give you joy.
Thank you. One thing that is even our viewers' joy is the beautiful flowers behind you, Judith. Helma Paulo Ali, who's watching from Las Vegas, commented that he just loves those roses. So, thank you both for being on the show. We could talk to you forever. I wish we could. Good luck, Carmen. You're going to be extraordinary. You are extraordinary. You'll continue to be so. Thank you so much, Judith. I think we all learned a great deal from you. Have a great rest of your time.
And we want to thank our producers. That's next. So we're coming to a close for our show. So thank you so much to our producers. And you see them here: Rose Harvest, Vandana Menon, Julia Weeks, and of course our executive co-producer Sri Srinivasan. Stay tuned, you guys, because next week we'll be back. Not like a bad cold, but we'll be back. And we have some great guests for next week.
We are going, next week, we're going to be celebrating Indian and Pakistani Independence Day, the She's on Call way. We'll be talking pediatric mental health with Dr. Ananta Dave, who is the president of the British Indian Psychiatric Association. And we're going to be talking about pediatric anesthesia with Dr. Anupama Yelluru Gotimukula, the president-elect of API, which is the American Association of Physicians of Indian Origin. Obviously, it's also another leadership show, so we hope that you can join us. And as I said before, we're going to be presenting the answers to the school questions starting on Tuesday online.
Okay, so look for us on YouTube, Facebook, LinkedIn. We'll see you guys next week.
Bye.